My name is Frank Kolisek. I'm an orthopedic surgeon with OrthoIndy in Indianapolis, Indiana. I specialize in hip and knee reconstructive surgery. I went to Wabash College in Indiana. I went to the University of Illinois Medical School. I then did my 5 years of orthopedic surgery residency at the University of Florida, and then I finished a one-year fellowship in adult reconstructive surgery of the hip and knee in Atlanta, Georgia at the Peachtree Orthopedic Clinic, Emory University, and Piedmont Hospital. Since I've been in Indianapolis, since I started my practice here June 8th of 1992, my whole focus and emphasis has been on reconstructive surgery of the hip and knee. Oftentimes I get asked when did I know what I wanted to do, and I'm a little bit strange when it comes to that, because as a sophomore in high school I actually knew I wanted to replace hip and knee joints for a living. I didn't know I had to go to school until I was 32 years old to do it. And I had my knee operated on a couple of times in 1975 and 76 playing football. I played football and baseball at Wabash College, and I had some personal friends, and I would go out during the summer and scrub into surgery with some of the orthopedic surgeons in the 70s and watch them replace hip and knee joints. And I really became very interested in it at that time, and I knew that that was what I really wanted to do. And as I said before, it's kind of funny because I'm like, I thought I could do that after about 2 or 3 more years of helping out. I didn't know it would take me another all those postgraduate years of study. So really I've known what I wanted to do, and all my decisions have been predicated on that ever since I've been 16 or 17 years old.
That was good.
You know, oftentimes patients will say, well, what do you like to do besides this? And that's a valid question, and I certainly don't try to hide anything. I'm a huge sports fan, so I mean, I go to all the Pacer games, and there's as many as I can, the Colts games, hockey, baseball. I'm really just a sports fanatic. My wife is too, so both of my boys played football at Wabash College, so that's been fun going all the home and away games there, and so we really enjoy sporting events and all that. We love getting out to eat with friends. I love having a glass of wine or a bottle for that matter, and it's kind of fun to sit back and reminisce and enjoy people's company and relax, because often two times we've got a phone to our ear, we've got a cell phone on our face, we've got our thumbs on our text messaging, and I think a lot of times nowadays that we just don't take time as people to just kind of kick back, put your feet up, put the cell phone down, and look somebody in the eye and talk to them and get to know somebody and relax and reflect. And I think that that's a lot of fun. So it's you know, traveling and doing the things that I really like to do outside of medicine. One of our big marketing programs at this point in time is about My Scar Means, and I can tell you that when I had my knee cut on a couple of times playing sports when I was younger, that My Scar means that I was able to get back out there and start playing again, because prior to that I couldn't. It hurt. And now I kind of look at it from the other side of the fence, and if my patients fail non-surgical intervention and we have to do either like a partial or a full hip or knee replacement, that my scar means to me on their knee or their hip that I've allowed them to get back into the game and start doing the things that are important in their lives that they had to give up because of a bad hip or a bad knee. So that's kind of what my scar means for me, sitting on both sides of the street as a patient and as a physician.